the sound I fall asleep to most nights because I'm married to somebody who snores. Now, despite what some people may tell you, snoring doesn't just affect the person that you're waking up at night. It also affects you. If you snore, you have a much greater risk for some serious health problems. But if you snore, you're not alone. The American Academy of Sleep Medicine estimates 30 million Americans snore on a regular basis. That's 1 out of every 8. Today we're going to discuss what causes people to snore, what health risks are associated with snoring, and what treatment options are available to people to help eliminate snoring. Let's first take a look at what causes snoring. When we sleep, the muscles throughout our entire body relax, and the muscles of the throat and the mouth are no exception to this rule. Snoring occurs when the muscles of the soft palate and the uvula relax to a point where airflow causes the soft palate to vibrate slightly. That gives us this lovely snoring sound that you heard just a few seconds earlier. The American Academy of Sleep Medicine associates snoring with an increased risk of obstructive sleep apnea. Now, 18 million Americans have sleep apnea, but 12 million of them do not even realize that they have sleep apnea. Sleep apnea is a very serious medical condition that occurs when the tongue and the muscles of the throat collapse to a point when airflow is completely obstructed. The obstruction must last at least 10 seconds, and it may last all the way up to 2 minutes. The brain eventually will receive a trigger that's saying, hey, you're not getting enough oxygen, and we gasp for breath, and then the whole cycle will repeat itself. Now, this may happen just a handful of times every night, or it may happen up to a couple of hundred times a night. This can lead to our sleep being interrupted multiple times throughout the night, which leads us to be drowsy during the daytime, which can cause us to have motor vehicle accidents or job-related injuries. Now, who snores? Men? Women? Well, both snore, but men are 2 times more likely than women to be affected by snoring. Also, age increases the amount of snoring that you do. If you're over the age of 65, you have a 50% likelihood of being a snorer. Also, being overweight increases the likelihood that you'll snore. If your BMI, or body mass index, is 25 or greater, chances are pretty good that you'll snore. And gentlemen, did you know that your neck size is a good predictor of whether or not you will be a snorer or potentially have sleep apnea? A neck size of 17 inches or greater indicates an increased risk for snoring. So we know snoring interrupts sleep. Let's take a look and see what serious health risks are posed by snoring. Our bodies require oxygen for survival. We know this. Whether we're awake or asleep, a shortage of oxygen will cause our blood pressure to increase because our heart has to work much harder to compensate for those lowered levels of oxygen throughout the body. The American Sleep Apnea Association says 50% of people with sleep apnea also suffer from chronically high blood pressure. This puts them at an increased risk for heart attacks, heart failure, even stroke. And Dr. Clive Layton, a British cardiologist, notes that people with sleep apnea are also more likely to have heart arrhythmias, coronary artery disease, as well as nocturnal sudden death. So the risk is very serious. But the good news is there are treatment options available to help people who snore. The first option for severe cases is surgical. You can have the tissues and muscles in the throat trimmed to avoid the excess tissue hanging down that obstructs the airflow. Then there's also devices known as nasal positive airway pressure devices, or IMPACT devices, for more moderate cases. And for mild cases, your treatment may be as simple as wearing a dental appliance or just losing a little bit of weight. Now, the most common kind of IMPACT device is something known as a continuous positive airway pressure device, or CPAP. This is worn by a person when they're asleep at night, and oxygen will be hooked up to this tube, which is not shown in the picture. Oxygen travels through this tube, which is snugly fitted against the nose, and the constant pressure keeps the airways open, which increases air volume and helps eliminate snoring. Now, CPAP devices are fitted only after a person has participated in what's called a sleep study, meaning you go to a hospital or a clinic and they observe you while you sleep to determine if this kind of treatment is the right course of action for you to have. The dental appliances that are available to help with snoring, such as the Silent Night Snore Guard, look something like this. With this type of device, the upper jaw rather, is connected to the lower jaw. And the patient is given a special key that they can turn to slowly bring the lower jaw forward into a protruded position, which helps keep airways open and eliminate snoring. Now, the American Academy of Dental Sleep Medicine recommends that these appliances be professionally fit by a qualified dental professional. You will see over-the-counter varieties of these products, but be forewarned, they don't work and they won't fit properly. Weight loss as well is another treatment option to help people succeed with quitting snoring. A weight loss of even 5 to 10 pounds can dramatically help. So let's take a moment to review what we've talked about today. Snoring interrupts our sleep and it can cause some serious health problems. But there are simple steps we can take to minimize these risks. We can lose weight or we can wear one of the appliances we've discussed today. So if your significant other says you sound like this, see your doctor. You'll sleep better and it may even save your life. Thank you, and I'll be happy to answer any questions you have.